Hi everyone, it's Dr. Amy Whedon from King's Day Out and Kidshine. I'm an occupational therapist, and today I'm going to talk to you a little bit about what you can do if you think your child is having difficulty processing sensory input. The first thing you can do is talk to people who work with your child on a regular basis. So you can talk to your child's classroom teacher or a babysitter or a grandparent, other family members that spend a lot of time with your child, and look and see how they are doing in different environments. So if you're seeing your child struggle at home, find out if they're also struggling at school. If your child's teacher comes to you and says that they're struggling at school, you might also want to look and see if there are some signs of some more subtle difficulties that are also happening at home. Once you gather information, the next place you can go is to your child's pediatrician. You can tell them very frankly what you're seeing and what the other people who are working with your child are seeing, and then they can direct you on what might be the best next step. Occupational therapists, especially those of us who work in pediatric outpatient settings, have a firm understanding of what might be a sensory processing challenge. In order for us to help your child and to do treatment, what we need to do is do an OT evaluation first. And for sensory processing challenges, what we do is a combination of a standardized assessment to help gather more information, clinical observation, which means we look at your child during the evaluation and see how they're interacting with the environment at the clinic. And then we also talk to the parent as well, because sometimes kids will present differently in different situations. So we really need to gather a lot of information from a lot of different sources and then investigate that and really try to come up with what we're seeing, what settings are making it more challenging for your child, and then we come up with a plan of what we can do about it. That plan includes goals. So we write goals for your child, and then always includes making sure that the therapist, the teacher, and the parent are all on the same page with what your child's treatment plan is going to look like. There are so many things that you can do at home, but they are all things that are individualized and specific to your child. So it's really important that you stay in close contact with your child's occupational therapist and say, hey, the weighted vest is working. The noise-canceling headphones are not working. A weighted blanket is definitely very helpful, or we need some help with sleeping or eating or this or that. So communicate with your child's therapist and work together as a team to help support your child.